Okay, part 2, tattoo study. Once again, we're looking at this table. And now we're going to talk about large tattoos. And although large tattoos reach significance for lymphoma and skin cancer, we're just going to talk about the skin cancer because my argument's going to stay the same. But let's look at skin cancer. So once again, 119 people who had skin cancer, 30 of whom had a tattoo, of whom 11 were large. And then if you look at their controls, so their twin controls, 104 people who did not have a cancer. Of those, 25 had a tattoo. Of those, 6 were large. And this did reach statistical significance where large tattoos were an independent risk factor for both lymphoma and skin cancer development. Now, once again, let's think about statistical significance, but then clinical relevance. We've taken this group of 300 odd people who've responded to this survey, and we've broken it down to, did you develop a cancer? And then if you've developed a cancer, did you have a tattoo? And then if you had a tattoo, was it a large tattoo? So when you take these population studies and break it down into subgroup, your cohort gets smaller. And when you have very small cohorts, even if something reaches statistical significance, it might not be as clinically relevant. So you do have to take it with a grain of salt. The other thing about this study, which they address in their limitations, they're very forthcoming about, is the fact that they really didn't address all of the other confounding factors that could impact things like tattoos, choices, or cancer development. So we know that smoking is an independent risk factor for cancer development and many different types of cancer. And really this study, it was just a yes or no. They really didn't assess things like pack year history, which could drastically impact cancer development. Same with alcohol, same with other medical comorbidities that could increase your risk of having these cancers. But they do address this, and it's an inherent limitation associated with epidemiological studies. So my conclusion of this study is that it clearly took a lot of work for these authors to do, and they did some very interesting analyses. And I think, like we like to say in research, more work needs to be done. But I don't think that this should be the study that makes you afraid of tattoos, and that's what I'm going to tell my patients. Now, will I change my mind if another study comes out? Maybe, but we have to be very fluid in medicine. We have to respond to literature as it emerges, and we have to critically analyze the literature, not just reading the abstract, actually looking at the results, actually discussing the discussions. So let me know what you think about this article and if you have any more questions.